Hi, I'm Dr. Georgina. Today I want to go ahead and answer a question I get asked a lot by patients, and that's whenever they're missing a tooth, it's whether should I get an implant or should I get a bridge. So, assuming that you already know what a dental implant and a dental bridge are, I'm going to go ahead and talk about the disadvantages and advantages of each. If you're not sure what it's a dental implant or what's a dental bridge, you can go ahead and watch our previous videos on that. So the very first advantage, and I feel it's probably the most important one, is that it's the closest replacement we have to your natural teeth. It's going to feel very natural and it's going to look, or it should look, very natural, very similar to natural teeth. Second is that you will preserve your bone structure. We know that every time we lose a tooth, there will be some bone loss. However, if you place an implant here, you'll still have that bone stimulation, that the bone cells will keep stimulating and you won't be having any bone loss. Therefore, your facial structures won't be compromised. Third is durability. We know that dental implants can last many years, more than a crown, more than a bridge. Of course, there's limitations case to case, but they have a very high success rate and they can stay in the mouth for a very long time, maybe up to 20 years or even more if you take good care of them. And lastly is that dental implants are not prone to decay, so you can't get any cavities there. I mean, I'm not gonna say you get it and you forget about it. No, there's still maintenance you have to do with dental implants, but it's not like a natural teeth that there's always risk for decay. Now let's go ahead and talk about the disadvantages of a dental implant. First one is the cost. We know they're costly, but it's an investment you're making for your health and it's a long-term investment. Second disadvantage is that not everyone's a candidate for a dental implant. There are systemic conditions, there are medications people might be taking that would compromise the procedure. Third is that you might need additional surgeries or treatments for that. For example, if it's a maxillary implant and there's not enough height, you might need a sinus lift. So sometimes this adds to the cost and it's a disadvantage for some of our patients. Fourth disadvantage is that it takes time. It's a procedure that it's going to take a few months, anywhere from 6 months up to sometimes we can go close to a year. So if you're looking for immediate results, it's not going to be the best option for you. And lastly, well, there can be complications. It's a surgery after all, and there can be short-term complications and there can be long-term complications. Know that there could always be an implant failure. So, but like everything, there's risk to everything, right? So those are the main disadvantages of a dental implant. Now, if dental implants are not an option for you, know that you have another option, and those are dental bridges. They're fixed, they stay in your mouth. So first advantage of a dental implant, it's the cost. Yes, they are less expensive than a dental implant, so sometimes that's the reason why patients choose that option. Second advantage is the time. You can get a dental bridge in 2 weeks versus a dental implant that you will need time for your bone to heal and everything. So it's a faster treatment. And lastly, I would say it's an option if you're not an implant candidate. I mean, implants are not for everyone. So that's another advantage of a dental bridge, that it's an option for patients that are not implant candidates. Now let's go ahead and talk about the disadvantages. Number one is that your adjacent teeth, meaning the teeth that are next to the missing tooth, are going to be compromised. We're gonna have to reduce that healthy tooth structure, or maybe you already have an existing crown there. We're gonna have to remove that and go ahead and reduce those teeth so we can go ahead and do the bridge. Because remember, The adjacent teeth are the ones that will be supporting that missing tooth. Second is that hygiene. Hygiene can be a bit tricky sometimes. You'll have to use a water flosser, you'll have to use a floss threader. So hygiene can be a little more difficult. It might take a little more time for you to do your whole hygiene routine. Brushing, flossing, water, etc. Another disadvantage is that they are prone to getting cavities, caries, decay, however you want to call it. After all, they're placed on top of your natural teeth, so they are prone to getting decay. And lastly, I would say the lifespan. The lifespan of a bridge ranges from 10 to 15 years versus an implant that can be more durable. Another disadvantage might be aesthetics. It can be sometimes challenging to get the best aesthetics results with bridges versus dental implants. I hope that clears some doubts and questions. If you have any more questions, I'll be happy to answer them. If you want a consultation, go ahead and give us a call and we'll be happy to see you. Thank you.